This video is going to be on dental photography. First of all, we have to get the camera ready to take a photograph. This is the Canon camera with a ring flash macro lens attachment. You'll notice that on the photo on the right, the flash is actually popped up. That sends a signal to the actual ring light for it to take the picture. There are 4 switches that need to be turned on in order for this to work. There's the battery pack. We're looking at starting at the top left photo. Needs to be switched to on. Dropping down to the next photo, that's the actual ring light itself. That needs to be switched to on. The camera flash needs to be turned on if it doesn't pop up on its own. There's a little lightning bolt. You hit that button. And then the camera itself needs to be turned on, and that switch is there. Also, the top right picture, you'll see that green light on the actual ring light. That tells us that the ring light is now charged up, ready to go. There's a couple of AAA batteries that are put in the bottom of the camera. And sometimes when those batteries start to wear out, it takes longer for that green light to illuminate. But once it's there, you can take the picture. If you find it's not coming on after, say, 10 seconds, it's going to be time to switch out the batteries. Also, the dial on top of the camera needs to be set to the AV position. All right, now let's start taking some photographs. What we'd ideally like to have with the smile is to show kind of the lower half of the nose and then all of the chin. If we need to go in and crop out or zoom in to crop the smile, we can do that later. But we'd like to have that much data. The pictures that we're taking with these cameras are very high resolution, so we can zoom in and not lose much of the detail. It won't start to pixelate. So having that kind of smile gives us an idea of how a patient's smile kind of fits within their face themselves. We'll take some actual face photos here in a little bit of this presentation, but right now, to get a close-up of the smile, this is what we would like. Here are some examples of what to do and what not to do. This one's zoomed in a little bit too close, but if we're going to get in this close, we want to be kind of heading straight perpendicular on top of the central incisors and not coming in at an angle. Here's an example. This is how we wind up with angled teeth. You see me positioned kind of directly right in front of the patient, just perpendicular to their face. Whereas in the picture on the right, I'm kind of coming down lower, like almost shooting towards their chin in that angle. And that's how you get that kind of off angle from where we need to be. So many times, this is the most frequent mistake when taking smile pictures, is taken from too low of a position. It needs to kind of come up and over the patient. It's a little bit further forward than what you would normally go. So that's kind of the remedy to that problem. Another one here is the smile is not quite lined up. You can tell that this patient's, their lip, their cheeks, their everything, their teeth, gums are all kind of slanting from upper left down to the lower right. It's kind of going in that line angle. The next picture down below, we ask patients to smile. And some people don't smile. They simply think that we want to just see their front teeth, and so they just kind of grimace or just bare their front teeth, whereas what we want is a real smile. Okay, so let's get the lips out of the way and do a retracted view. So this is what we call front retracted with teeth in occlusion. So the teeth are put together, and you can see the lips and cheeks are out of the way. What makes this a good picture? Well, let's take a look. First of all, the frame extends a few millimeters beyond the buccal surfaces of the molars. That's where you see those blue arrows. Also, the black arrows show us there's several millimeters of gingivas being shown within the frame, both upper and lower. Also, the occlusal plane is leveled up horizontally with the frame of the picture, and that the left and the right are evenly split between the sides. So that's a perfectly centered and horizontally correct picture. Again, when we zoom in to take these pictures, we can have them come at these funny angles. Right here we have retracted teeth that are out of occlusion. This is what we're looking for. We want to have the teeth just slightly separated. So here we are. Again, picture is horizontally centered within the frame. We can see the molars, but now the bite is open, just about 2 to 5 millimeters, so we can kind of see where the incisal edges are on these teeth. Here are some ones that aren't so great. What's wrong with the top photo? Well, number one, it's not centered. It's canted over to the patient's right, or shifted over to the patient's right. The bottom teeth, they're not even visible in the frame. The left posterior teeth, since it's shifted so far to the right, the patient's left teeth aren't even visible, and the bite is open too far. The next photo. This photo is not taken straight on. the camera slightly to the patient's right again, and notice how much more you can see of the right posterior teeth than you can of the left. So although this isn't a terrible photo, you can tell it just wasn't centered the way it should be. Here's another one. The bite's open too far, plus it's going at a really funny angle. It's kind of sloping downward as you go from left to right. Now the next picture we want to look at is the retracted side with teeth in occlusion. This is probably more difficult photos to take and try to explain. Think of this as the canines are the star of the show. We want to see the canines and how they fit together. We want to get kind of a profile view of those teeth. The molars would be great to get those in this photo as well, but sometimes the lips or cheeks don't go back far enough to allow that. But the canine is what's most important. So look at some features again, what makes this a good position within the frame kind of picture. Several millimeters of gingiva again on the upper and lower. We can see that none of the cervical areas of the teeth are cut off. We can see there's a little bit of space. Look at the far right, that little tiny blue arrow. That shows there is a little bit of, I mean, you can tell that the picture just wasn't cut off. We can see where the retractor went back as far as it was going to go back. So it shows us that we got the most visible real estate that the retractor would allow. Also, we're looking at on the contralateral side, on the patient's right side in this case, that the frame extends a few millimeters anterior and posterior of the teeth. I mean, we talked about that blue arrow on the posterior teeth, but the anterior teeth, you can see that the frame extends a little bit beyond. The actual picture did not cut the teeth off. The teeth are completely within the frame. Also, that the horizontal plane is lined up with the frame, and the upper lower arches are split evenly on top and bottom of the actual picture frame. And also, the side arch photo should show only a little bit of the other side's anterior teeth, or the contralateral side. So in this photo, you can see just a little bit of teeth numbers 6, 7, and 8. They're only slightly visible. We want to be able to see a little bit of that. You can even not include the canine or the lateral, just maybe part of the central. If you want to turn the camera a little bit more, angle it to kind of show a little bit more of a profile of the canine, that's fine. But you should see a little bit of the contralateral anterior teeth, mostly the central, and you could have the lateral and the canine, like you can see in this example. Here are some problems. Occlusal plane is not lined up with the frame. The frame is the blue thing, and you can tell that the line of the teeth are just kind of cutting across and going from up high on the left, going down low on the right. And then the other one is the right side teeth are not within the frame, and they're cut off, and the teeth are not even in occlusion. So this would not be the right kind of photo. Here's another one that we see sometimes, that the patient's posterior teeth are not even shown. We can see the canine. I said the canine is kind of the star of the show, but we don't want it to be pretty much the only one in the show. We want to have the other teeth posteriorly show as much as we can possibly show. In order to fix this kind of problem, the retractor needs to be pulled back further. And you can do that by having the patient let up tension on the opposite side. So if you could let up tension on the far away side, you can maybe pull more on the side that's towards the camera. Also, we've got smaller retractors that don't have such a wide arc, and that may allow the cheek to come back more. But there are some patients that the cheeks just simply don't allow you to pull back as far as we'd like, but you can at least give it its best try with those two hints up above. Again, just showing an example of this is correct. The one on the left and the one on the right is showing that the teeth are running at a funny angle. Even though they're in occlusion, even though we can see the upper and lower gums, even though we can see the contralateral all the way to the canine, they're just not lined up the way they should. And it's just the simple fix. It's just rotate the camera within your hand. The patient doesn't have to change the position. You just have to rotate the camera. Again, same kind of thing with the picture on the left is what we're aiming for. The one on the right, again, it's coming from underneath, almost like from underneath the patient's chin, coming up from that angle instead of just having it coming directly perpendicular to the facial surfaces of those teeth. Again, this is showing how that can happen. You can tell on the left side, that's the photo position, but you can see if I drop kind of down a little bit lower and point the camera up, I get this kind of distortion. Here's some examples of some really good photos. You have one with the anterior teeth in occlusion, with them slightly out of occlusion. We have them on the right side, we have them on the left side. This is exactly what we're aiming for. This looks really, really good. Okay, arch photos. Here is the upper arch photo. This one looks really good. Why is it good? Well, We have a few millimeters that extend the frame of the picture, extends beyond the facial surfaces of the very front teeth, and we have a little bit posteriorly. We can see that the second molars, we can see those really well, and we can see the frame of the picture extends beyond or distal to the most distal tooth that's present. Also the left and the right, there's some little bit of space there as well. You don't have the cheeks or the teeth being cut off from the frame, and the left and the right are evenly split. The frame of the photo, the palatal midline, again, this is lined up vertically within the frame. That's what we're aiming for. Here are some problems. Their cheek retractors didn't allow the lips to get off of the teeth, and so lips are covering up the teeth. We can see the back teeth, but as you can see, the front teeth are being obscured by the lip. Or, as I just kind of mentioned in the previous slide, the camera was rotated, and so even though we can see pretty much everything, it's just best if we have this lined up better. Also, it's a little bit out of focus. This is another one where the mirror just wasn't put back far enough. So you can see second premolar to second premolar, but we can't see any of the molars. And this is an easy fix. You just simply have to move the mirror further back and reposition the camera to capture the anterior teeth and the molars. Here's another one where if the patient can't open that far, then it's going to be difficult to get that full arch photo. But in order to get as much of the biting surfaces of these teeth as possible, you sometimes need to really, I call it, crank the mirror over, like really take advantage of how far the patient can open to grab that photo. And sometimes it's kind of a little bit of a dance. You have to get the camera position just right, the mirror just right, have the patient open really big, have somebody, the assistant, or warm up the mirror ahead of time to keep the fog off the mirror so you can finally get just that right picture. But right here, if you could just crank the mirror, turn the mirror a little bit more to reveal the lingual surfaces of the anterior teeth, then that would have been much, much better. Here's a lower arch photo. Same kind of basic principle. We're trying to get both the front and the back teeth, not cut off any of the buccal surfaces, not have the tongue be in the way. We'd like to see the lingual surfaces of the lower front teeth. We'd like to have the lip off of the teeth. Right here, you can tell it's touching a little bit. It's acceptable. Ideally, we'd like to have the lip a little bit off, but this works really well too. And this kind of shows again what I just discussed, and that is having the frame completely allow all the arch to be seen. And you tell it it's centered, left and right, or evenly split across the frame. This one again, kind of like before, the mirror just wasn't tipped back far enough. I can see the facial surfaces of the front teeth, but I can't really see the lingual surfaces, and that's what we're trying to get to on this. Plus, if you can see, the anterior teeth are mostly somewhat in focus, but the back teeth, since they're so far back, they are not that well in focus. They're kind of blurry. Here's another problem. We can have fog on the mirror. The midline is not lined up, and the front teeth have been cut off of the frame. So there's multiple problems with that top photo. The bottom one, again, there's a little bit of fog developing on the second molars, and the midline isn't lined up with the frame. It's kind of rotated. Here's an example on the left side of how it should look. The one on the right, top right, that shows the mirror not being turned far enough to allow us to see the lingual surfaces of the lower anteriors. And then the very bottom right picture just shows, again, it being cut off. The mirror edge wasn't pushed back far enough posteriorly. And here's some more subtle details. The arch wasn't entirely captured. You can tell that the patient's right molars were cut off. And then on the bottom, again, not completely in the frame, the left molars were cut off. And sometimes this simple fix is just zooming out, and then you can capture everything. But as I just talked about, you can zoom out. We can zoom out too far. I guess if you're going to err, would you rather zoom in too far or zoom out too far? I guess you'd rather zoom out too far. This is a subtle detail, but if you were to zoom in more, you could get rid of some of that excess tissue that's not needed. These green arrows kind of show what is excess of. The bottom shows the picture actually being cropped and how it should ideally have been taken. And you can kind of see everything that's on these yellow lines. To the left of the yellow line is unnecessary. Everything below the yellow line, that too is unnecessary. So adjusting the zoom to get the arch to fit within the actual picture frame would be ideal. Here again on the upper, there's too much excess tissue on the left and right, as well as you can cut off the the bottom part of that frame as well. So again, to these yellow lines, you can go outside those yellow lines, cut that off, and below the lower yellow line, you could cut that off as well. Here's some really good pictures. Those look nice. And of course, then when we get the pictures ready to send off, say to Invisalign or present to a patient, we would take and flip like that bottom lower one. We'd flip it so that the lower arch actually dips down to the lower. So we do a vertical flip. Plus, when you take mirror pictures, you have to check with the patient's chart to see if you have the left and right. Like in this example, it looks like it's tooth number 3 that has the amalgam filling. But if you look at the x-ray and see that the amalgam is really on the patient's number 14, then you have to go to the picture, since it was taken in a mirror, and flip it horizontally to get things to match up. But this is really more of how to actually take the picture. But after the picture's been taken, there are some things we can do in processing to fix some of these left, right, up, down issues. Sometimes we take quadrant photos. This isn't necessary for Invisalign, but we just take them for clinical reasons. Again, we want to have, this is a very good picture. What makes it good is that we can see all the posterior teeth. We can see that from the canine, which is an anterior tooth, but we can see all the way back to the second molar and go distal to the second molar. It's also lined up with the actual picture frame. This one does show all the teeth, but you can just see it's running at this kind of 45-degree angle. We'd like to just turn the camera, rotate it so that the teeth are really lined up. Plus, we'd like to see more of the occlusal surface and not so much of the lingual, unless there was some crack in the lingual we're trying to specifically take a picture of, or maybe in this case, the mesial of the molar, the first molar, we may want to show that crack. And so coming in at this kind of funny angle would capture that. But ideally, if we're taking an occlusal photo of a quadrant, we want to then turn the mirror and the camera, kind of work together to see how we can get a more direct occlusal picture. A couple other things, smudges on mirrors, that's going to cause things to be out of focus because the camera may focus on the smudge instead of the teeth. Also, having it dialed in the zoom just right, it may focus more on, say, the skin of the tooth of the patient instead of the tooth itself. Water spots, of course, this one was lined up really nicely, but there's a water spot, and that kind of throws off the overall picture. Portrait photos. There's 2 ways of taking portrait photos. We can take it with that big camera that we've been featuring so far, or we can take them with an iPhone. If we take them with, either way will work. The principles are still going to be the same. This portrait photo, we want to have a little bit of space beyond the top of the head and to the left and the right. The patient is smiling, of course, and smiling, showing teeth. And then also the camera is set about the same height as the patient's eyes. And you want to make sure you don't cut off like the chin. So we go ahead and extend the frame down to the middle upper part of the chest. Coming from the side, this is a direct profile. Think of it like a mugshot photo where you want to have the person looking directly at the side. You can tell, though, with this background, I'm standing, this picture, this is actually me, but I'm standing too close to a background. And you can see the shadow on that white thing. And so if you look at my teeth, you can see a little shadow beyond there. And that's a little distracting. So we want to have the patient away from any wall or surface where a shadow might be cast. So what we've been doing now is we've actually switched to taking a portrait and side photo profile pictures of patients using an iPhone combined with a ring light. The ring light, simple, we just put the camera inside where the ring light is, and they have the patient stand about 1 arm's length away from the ring light. And we're going to make sure the camera is held up vertically in the landscape position, not in the, in the vertical portrait position, not in the landscape. We're going to set the camera to portrait mode, have it be a natural light. And we're going to tap the screen until we see that yellow box appear. That's going to allow the picture to be in focus. So we take a smiling picture, and then we'd have one that's in repose. You can tell we're using a ring light because if you look at the patient's eyes, it has that little white light. That is the actual ring light that we see reflected in their eyes. Taking one from the side, again, we're going to take one that's not smiling. They call that in repose. And then we have one with them smiling. In this case, the patient's hair is pulled back. We want to make sure that the hair is up and over the ears when we take that photo. And of course, any glasses that they're wearing, we want to make sure they're not wearing any glasses when we're taking the pictures either. Here's a difference between a normal picture and one that's overly washed out. How this can be avoided is if you tap the screen, that yellow box that was right there, when that appears, then the camera kind of recalibrates itself to the light so you don't get these washouts. And that's it. That is dental photography. Hope you enjoyed it.